Good evening. My name is Kent Wong. I'm the director of the UCLA Labor Center, and I'd like to welcome all of you to Labor's Voice. This is a program that is produced twice a month in partnership between the Los Angeles County Federation of Labor and the UCLA Labor Center. And each segment, we bring to you topical issues of the day that talk about what is going on in the world of work and how working people right here in Los Angeles are making a difference during the COVID-19 pandemic and in addressing the needs of the broader community. Today's topic is on stopping the spread, workers on the front lines. And this is a very topical issue for us to be addressing as we are witnessing here in Los Angeles and here in California, the spiking of COVID-19 cases, as well as the increase in the hospitalization rates throughout Los Angeles County and throughout the state of California. And in the midst of this crisis, we have essential workers who are on the front lines doing all they can to ensure public safety. So tonight's Labor's Voice will talk about some of these frontline workers. We'll interview them and we'll hear from their stories. We'll be hearing from a public health professional, an emergency medical technician, a grocery worker, and a leader of the LA County Federation of Labor. And together, we will be addressing what we can do to stop the spread and what can we learn from workers on the front lines. And to welcome tonight's program, we have my good friend and sister, Aquilina Soriano, who is the director of the Filipino Workers Center, one of the most dynamic and vibrant worker centers in the country that for years have been advancing worker justice and social justice. So before Aquilina will join us in singing, I wanted to just ask her, what is the Filipino Workers Center doing right now in the midst of the COVID-19 pandemic?
Mm-hmm. Well, thank you, Kent, and thanks for asking me to join tonight. The Filipino Workers Center, like all of us are doing, we're building worker power to really address the needs that and the issues that we're going through. We organize domestic workers, Filipino immigrant domestic workers, especially home care workers. So they have been essential workers on the front lines, both in small facilities and then in individual homes, and the lack of PPEs and also the lack of the ability to quarantine safely because they live in such crowded conditions. We've been responding to some of these very immediate needs of facing higher costs of transportation, trying to avoid public transportation to get to work, as well as housing where they can safely quarantine away from other caregivers who might then spread it to others, as well as really providing care funds, some financial assistance, and at the same time welcoming in hundreds of new workers into our organization and bringing them to the fight. So we're advocating for public health councils of workers here in Los Angeles, right? And also advocating for a California domestic workers health and safety bill so that we are no longer excluded from health and safety protections. So the song that I'm going to share with you is called Tatsulok, which means triangle in Tagalog. And that really represents the demographics of our society, with a very few with riches on the top and the majority of people struggling with poverty on the bottom. And it talks about how as long as we have this basic system of inequality and this big gap of inequality, there will always be this kind of violence that we're experiencing in our communities. Totoy, bilisan mo ang takbo. Iligan ang mga bombang nakatuktok sa ulo mo. Totoy, tumalon ka, dumapa kung kailangan, at baka tamaan pa ng mga balang ligaw. Toto'y makinig ka, wag kang magpagabi. Baka pagkamalan kang humandusay dyan sa tabi. Toto'y alam mo ba kung ano ang puno tulo ng di matapos-tapos ng kaguluhang ito? Hindi pula't dilaw, tunay na magkalaban. Ang kulay at tatak ay di siyang dahilan. Hanggat marami ang nukmok sa kahirapan at ang hustisya ay para lang sa mayaman. Habang may tatsulog at sila ang nasa tuktok, hindi matatapos itong gulo. Hindi pula't dilaw, tunay na magkalaban. Ang kulay at tatak ay di siyang dahilan. Hanggat marami ang lukmok sa kahirapan at ang hustisya ay para lang sa mayaman. Habang may tatsulok at sila ang nasa tuktok, hindi matatapos itong gulo. Hindi matatapos itong gulo. Thank you.
Thank you, Aquilina Soriano, for that beautiful song. And also thank you for all the extraordinary work that you do at the Filipino Worker Center. Now, our first guest tonight is my good friend and colleague, Linda Delp, who is the director of the Labor Occupational Safety and Health Program, one of the very vital institutions here in Southern California that advances safety and health issues for working people. Linda teaches at UCLA. She got her PhD in public health and is a public health expert who is out there in the community every day supporting workers on the front line. So welcome, Linda. And the first question is, tell me a little about LOSH and the role of the Labor Occupational Safety and Health Program in serving as a public health resource.
Thank you, Ken. I'm really happy to be here tonight. So UCLA LOSH educates and advocates for worker and public health. We believe that where people work every day affects their health in all aspects of their life. So work, for example, can bring satisfaction and rewards, but it can also be hazardous. So LOSH leads many training courses on workers' rights and protections. And most recently, we've gotten a huge number of calls for information about COVID-19 protections. We've done training and developed curriculum with janitors, nurses, farm workers, and we also do research and help to try to inform policy decisions. So right now, for example, there's a push to try to get an infectious disease prevention standard that applies more broadly than just healthcare, but to all industries in California. We also have some of the research that our student interns have done has helped to support the Domestic Worker Bill of Rights that Aquilina was referring to, and also helped to support some of the policies related to preventing workers' exposure to wildfire smoke. So
Thanks so much.
In this particular moment of COVID-19, it's been so very clear how worker health and public health intersect. And what I've been really amazed by is how society seems to be finally recognizing the invisible and important role that workers play in protecting public health. So people they provide, healthcare for us, deliver our food, allowed us to stay home, during the lockdown. And so these are all services that have been considered essential, but these same workers are too often treated as expendable. So sometimes even I was talking to garment workers today, and workers get sick, they just leave and new workers come in. So treated kind of like cogs in a machine that are just expendable. And I think some of the statistics that we're seeing right now are really clear about how the rush to reopen the economy without public health precautions in place has been at the expense of all of our health, but especially workers on the front line. I do have 2 slides I can briefly show to illustrate. So the first slide is almost 3 months apart. We can see how the end of April, we had less than 20,000 confirmed cases. It's now over 140,000 with almost 4,000 total deaths. And 2 days ago, only 2 days ago, we saw the highest number of daily counts of reported new COVID-19 cases with over 4,073 deaths reported in 1 day. I think this shows how the rush to reopen the economy has been at the expense of workers and the public. The next slide shows how the inequities in our society have been exacerbated by this pandemic. So here we can see this is the death rate. We can see that African Americans, Hispanic Latinos have much higher death rates than whites, which are at 22. And then those living in areas of high poverty are at 78 compared to wealthier areas of like a death rate of 19. So these inequities have really been exacerbated, and the certain groups in our population have borne the brunt of this pandemic.
Thank you, Linda, for sharing those two slides. And it's very unnerving that there has been such a huge increase in COVID-19 cases and in hospitalization rates, and that there's also such a disparity with regard to race and class. And so Black and brown communities are suffering at disproportionate rates, but also lower income communities are suffering at alarming rates. And so we'd like to have you address a little more of the basics in terms of, as a public health expert, what can you tell us about the spread of the virus, and also what industries in particular are at risk?
So I think if we're looking, our goal, the theme of this whole session is stop the spread. So I think if you go back just one slide, Evan, I think in order to stop the spread, we have to remember the basics of how the virus can spread. And it's basically by droplets being airborne and droplets that contaminate surfaces. Next, please. So if we have in a workplace, even one person who's been infected and we don't have certain precautions in place, this slide shows how exponentially the virus can spread. So I'm going to highlight 3 really basic precautions that I think people need to remember and what employers need to do to make sure to safeguard both workers and the public. So first is stay home when sick. We've all heard that. Workers don't want to go to work when they're sick, but sometimes are forced to choose between feeding their families and their income and their health and the health of their coworkers. So we absolutely need to have in place paid leave for workers who are sick or who are exposed to be able to stay home in order to protect the public health. Secondly, don't share your air. So barriers, social distance, appropriate masks or respirators are absolutely critical to make sure that in places where to make sure workers and the public are protected. So what we see in some cases like garment shops, in some cases like warehouses, if there's crowding, or if there are places where people can't keep it clean because they have no time or supplies to wash their hands or clean down surfaces, the virus is going to spread. And the next slide shows how a workplace can be a hub that what happens at that hub are absolutely critical to public health, because we see workers at the circles and then sort of the rectangles or the public coming and going from places like restaurants, grocery stores, retail stores. People come and go all the time. And so what happens at that work site and what kind of policies and protocols are in place is going to be critical to protecting public health. So what the next slide shows which companies and which kind of workplaces have particular risks. This is a chart that my Loesch colleagues have summarized from data that the public health department keeps of the cases. So in hospital and healthcare, employers are required to report if there's one case, and in other industries, if there's a cluster of more than 5 cases of COVID-19. So there's a couple key points here. First of all, this is not complete. It's a really important initiative to try to track what's happening at the workplace, but it's not complete. I believe that there is quite a bit of underreporting from employers, and we need to fix that so we know what's happening. But from what we can see here, clearly healthcare is at the top of the list with almost 5,000 cases, followed by food processing. And then behind that is manufacturing, both apparel and non-apparel, correctional and law enforcement, and retail. And also we see some fewer cases, but scattered across different establishments in restaurant, recycling, warehouses, homeless services, as well as grocery stores. And so what we know about these places, and we'll hear more from workers in a minute, that there are likely places where people come and go. There may be crowding, making it impossible to maintain a safe distance. And there are often production pressures which prevent like frequent hand washing and cleaning. So.
Those slides are very helpful, Linda, in both giving us an overview of some of the industries that are more at risk. And it was shocking to see the statistics at how prevalent the problem is within the healthcare industry, but also within the grocery industry. And you mentioned today about meeting with garment workers, and we read in the paper about garment workers who are producing masks for the public are at great risk. And in fact, a number of them have died as a consequence of unsafe working conditions and conditions at work. The final question to you, though, is that there is a lot of debate and a lot of pressure on workers to go back to work. And what are the things that workers could be doing, not only to safeguard themselves, but to safeguard public health at large?
First, I want to highlight that workers are the experts in their job. So they're at their workplace every day. They can be the eyes and ears to identify what the risks are of spreading the virus, and also to share constructive ideas for how to stop the spread. So I believe that workers have to be trained to identify the risk, and they have to be able to speak up without fear of retaliation from their employers. So workers, I believe, can play a really key role in promoting public health, identifying public health violations that threaten their own health, as well as the health of the public, their families, and their communities. And the time for action is now, quite frankly. We're at the highest number we've ever seen. We have to stop the spread for the sake of everyone. And we at Loesch are happy to support workers as promoters of public health in any way we can.
Thank you so much, Linda Delp. Thank you for the Labor Occupational Safety and Health Program at UCLA. And we really hope that other labor and community leaders who are watching the show will turn to the great work of Loesch and to draw upon their expertise as advocates for public health and for worker safety and health. We are now going to shift into the area of healthcare workers who are absolutely are on the front lines, who are putting themselves at risk every single day. And we are so fortunate here in Los Angeles to have a large and robust union, such as the United Healthcare West, which is part of the Service Employees International Union, that represent thousands and thousands of healthcare professionals statewide. And so we're going to start off with a short video that shares some of the work of the UHW, United Healthcare West.
We are leaving our frontline healthcare heroes unprotected and in danger.
Look, guys, I'm scared. This is scary because we're told we only have one of this to last us the entire shift, and some cases for the rest of the week. Please, whoever out there is listening, we do need PPEs to take care of these sick patients.
Now we can protect our heroes so they can protect us. Sign the petition to support SB 275, the Healthcare and Essential Workers Protection Act.
Joining with us tonight is Gabriel Montoya, one of the activists from SEIU, United Healthcare West, and he is also an emergency medical technician. So Gabe, welcome tonight, and tell me, what is an EMT and what are your job responsibilities, especially during the COVID-19 crisis?
Well, hi, yes, my name's Gabe, I'm with SEIU UHW. I'm an EMT over at Kaiser Downey Medical Center. And so, part of my job as an EMT is really to assist physicians and nurses in the emergency department as we care for all patients. But during this time, specifically, EMTs are trusted with doing the work of making sure that nurses and physicians who are going into COVID positive rooms are able to do it in a safe way, are able to do it in a way that they are protected, and also do it in a way that we're not cross-contaminating staff that are coming in and out of COVID positive rooms. In addition to that, we're also working on drive-through testing at our facilities, which includes swabbing patients who are potentially positive or people under investigation for COVID. And then, of course, we also have our regular duties, right, of doing electrocardiograms on patients. We still have to take care of patients who come in with, fractures and injuries, in other forms, and heart attacks, strokes, all of it. And on top of that, we're caring for COVID patients. And then we have the intersection of patients who can come in with heart attack, strokes, and also be COVID positive. So the job has changed a little bit, but either way, we're still dedicated to doing the work, but we want to be able to do it as safely as possible.
Well, we are very grateful for your work, Gabe, and for the work of other healthcare workers who are on the front lines every single day. The video talked about a new Senate bill that is being advanced. What are some of the concerns that healthcare workers face, especially with regard to PPEs, personal protective equipment?
Yeah, so, what we're seeing, and like Linda had referred to earlier, we did open up the economy quite quickly. I think we went ahead of the science when we first thought we wouldn't in the state. We certainly did. And so, there was a time where our state, where our country had the ability to play catch up in regards to personal protective equipment. And instead, what we did is we squandered that time away. And so now we're seeing a surge in patients because we've opened the economy very quickly. And it really gave the sense to the public that everything's cool, right? It's okay to go out, go where you want, have family gatherings, because the pandemic's over, right? Because you can go to the gym now, right? But the reality is that was a false sense of security. And so now we're looking at the surge. One of the things we're facing in the hospitals is we're being very, very much challenged by way of being able to have the capacity to care for these patients. So as we're filling up ICUs, as we're filling up medical surgical units in all our hospitals, we're using a lot of PPE to take care of these patients as our capacity fills. And I got to be honest with you, we were looking at a huge shortage at the beginning of this pandemic. And then when our numbers, we were kind of really pushing down on the curve, we were doing okay with PPE, not great. But now we're in this position again where we have another shortage of PPE. And because our union, United Healthcare Workers West, we represent 100,000 hospital workers and clinic workers. And really, we have to be the voice, right? Workers are going to be the voice, because I'm going to be honest with you, employers of healthcare workers in the state, even through this pandemic, their goal has been to look at the bottom line. Our goal has to be to watch out for patient and worker safety. So we are introducing Senate Bill 275, which is a bill that's really going to push the state to have to carry a 90-day pandemic level stockpile of personal protective equipment. And so that means, face shields, masks, gowns, everything we would need to cover the parts of our bodies that will come in contact with droplets or, micro droplets and aerosolized procedures. So, and this also goes further to ensure that employers of healthcare workers are also going to have a 90-day supply of pandemic level personal protective equipment. This is very important because we're talking about keeping patients safe also, right? So as workers, if we are not protected while we do this work, what we really do is we become vehicles of transmission, right? If we aren't protected, we take it home to our families, right? We take it home. I mean, we can take it from patient to patient. And so the public needs to really know that this is not only about protecting healthcare workers, but this is about protecting entire communities when your healthcare worker has the correct PPE. And I think, Kent, that we also need to think about the fact, which Linda also referred to earlier, is the fact that this is really hitting Black and Brown communities hard. We didn't have the option to stay home. Most of our communities are working on the front lines, right? A lot of us are working, low wage jobs in the front lines, sometimes multiple jobs at one time. So where other communities were able to sit at home in front of a computer and do work, we were out there, right? We were taking the brunt of it. And so this really set communities of color up to really get hit hard by this pandemic, when they are already facing issues of having access to healthcare before this pandemic. And so when I work in the ER, I work in an ER in Downey. That means we are surrounded by Latinx communities and Black communities that we service. And so we are seeing where I work, a community come in, and most of the time when these people come in, my people, right, that we want to care for, they come in, it's entire families coming in, right? And it's people who really were looked at by their employers as dispensable. You can get sick, go home, and we'll just replace you with the next guy. And so that's what we're facing in these communities. And we really need to be hard pressed on how we're protecting them. So, part of this bill is going to prioritize communities of color. We have plenty of community clinics out there, community hospitals out there in poorer areas where their healthcare workers, first of all, don't have the right protection for themselves, which means they have the ability to hurt their own communities. And then on top of that, we really have to start thinking about the fact that as these smaller community hospitals and these communities of color are impacted harder, they run out of space. And if their healthcare workers are getting sick, they run out of people to care for them. So all this really did is it really highlighted the racial disparities that we've already seen across this country and in this state and in this county, Los Angeles County, to be frank. And so we wanted to do something about it as healthcare workers, step up to the plate and move the state into action. In addition to that, since this is a workers forum, one of the things that we're also pushing is that 25% of that personal protective equipment is to be made here in the state of California, because we also need to be able to have control over the supply chain. That is one of the big issues that we saw early on in personal protective equipment, is that a lot of our employers had trouble getting the personal protective equipment because they couldn't control the supply chain. And our federal government just seemed to go chasing its own tail when it came to really addressing supply chain issues. So having it made in California gives us the opportunity to create California jobs. And in addition to that, helps us control the supply chain as we try to control this thing.
Thanks so much, Gabe, for sharing with all of us the importance of SB 275 and to share with us the critical shortage that we are still facing months and months after the pandemic. We still do not have enough PPEs for our frontlines workers. And
let me just add, Kent, that this is part of workers taking the initiative to make a decision about how people come into our place of business that we work at. This is not only about PPE for workers, this is also about making sure that workers have a say about how people come into our places of business. Employers, a lot of times, are worried about the economics. We as workers have to worry about the safety. And workers across every sector, including healthcare, need to be able to address issues where employers are violating or allowing customers or patients to violate masking and social distancing policies. And workers shouldn't be the ones out front just alone having to enforce these rules. Employers need to actually step up to the plate. But if they're not going to do it, workers are more than willing to do so, right, for their communities.
That's great, Gabe. One of the things you mentioned is that there are over 100,000 members of SEIU UHW. Yes. And so what difference is having a union of healthcare workers, what difference does it make in terms of these very issues that you were addressing? Why is a union of healthcare workers so important?
Well, for one, we're able to use our collective voice and collective political power in order to address issues like the one we're addressing in regards to personal protective equipment. Let's be honest, if it wasn't for workers, we wouldn't really have a workers' unions. We really wouldn't have people standing up for personal protective equipment. Honestly, I haven't, California Hospital Association is of yet to stand up and say, hey, we're going to join you. A lot of employers of healthcare workers have yet to stand up and say, hey, we're going to join you in making sure we take care of this situation. So the workers have had to stand up and do that. That's part of the collectivism of unionism. And also what we've been able to do as workers that are part of this union is when we see that there are either their blind spots or their areas of safety that our employers have missed, we utilize our union contract, we utilize our collective voice to really, in a lot of cases, put our foot down and say, look, this is not the time or the place that you're going to put us in danger. And that means, we've even had to go as far. In fact, today I was on a committee meeting with my employer, with administrators at my own hospital, letting them know that there are places as far as safety that are blind spots that they're missing. And so as workers, because we are part of a large union, we're able to put our foot down and say, look, Kaiser, look, Dignity Health, here are the areas that we need to fix things so that we're keeping not only workers safe, but patients safe as also. And if that means making sure people are masking up when they come in, that means making sure that people are being asked the correct questions before they come into our hospitals. That could also mean something as basic as the spacing that we expect patients to have as they wait in the waiting rooms in order to keep each other safe. We're having a say in all those things. And that's why it's important for healthcare workers, in fact, all workers of all sectors, to have a collective voice, because you can't have one worker taking on $1 billion company like the one I work for. It takes 65,000 workers to take on $1 billion company like the one I work for, right? In order to keep ourselves safe and make sure that we're prioritizing people over profits.
Thank you so much, Gabe, for joining us tonight. We are really grateful for the work you do every day as an EMT, and we are also grateful for the work of SEIU UHW in leading the fight for SB 275, for PPEs, and to make sure that all people within the state of California have a right to healthcare access, and all people in the public have a right to public health and safety.
And we do ask that our labor community do reach out to their local assembly member and state senator and ask them to vote yes on SB 275, because it's just not about health coworkers, it's about the whole community.
Absolutely. So for everybody listening, please do all you can to contact your members of the California State Legislature, ask them to support SB 275. It is in all of our best interests. Thank you, Gabe.
Thank you.
Our next speaker, we're turning now to another industry of essential workers, and that is in the grocery industry. And with us tonight is DeAndre Williams. He is a leader and activist in the United Food and Commercial Workers Local 770, and he's also a supermarket worker. So DeAndre, tell me what is going on in the supermarket industry in the midst of the COVID-19 pandemic.
Well, thank you, Ken, for having me. What's going on in the supermarket industry is a lot, actually. One major thing that's going on is, with this pandemic, first off, starting with us as workers, we are hearing everything just as much, hearing everything and getting everything in just as much as anyone else. So when we go to work every day, when this thing first started, we didn't know how bad it was or what it was or what kind of protections were needed. Just like the rest of the public, all we knew was we wanted to help, get these people groceries, because it's something that we all need as groceries, and we wanted to do our jobs and make sure it worked. As this thing has gone on, we start to see that not only our family members, our friends, our customers, everyone we know affected by this, but it's showing us that our company really doesn't even care for us as workers. It's all about dollars and about money. And that's really what COVID-19 has really showed us in the supermarket industry. And I speak for not just myself, I work for Rouse Market, but also Vons, Albertsons, and for everyone else that I'm hearing from when we have meetings, it's like pretty much the same thing. We're just a number to them, and we're treated like a number. And the COVID-19 threat is real, and people are getting sick, and we need to be protected.
Well, thank you for sharing that perspective, because on the one hand, you are referred to as essential workers, but in the eyes of these corporations, you're expendable. And corporations and companies are not taking the precautions needed to not only safeguard their workers, but to safeguard the public at large. So there has been a major problem with COVID-19 cases in the supermarket industry. Could you walk us through that? Why is that such a big issue within this industry in particular?
Well, why that's such a big issue in this industry in particular is because, like I said earlier, we all need groceries. This is an essential business. We all have to go to the grocery store to fulfill our needs, whether that's food, sustenance, supplies, whatever. We're all here to try to help. And when we're dealing with the public, and if it's not safe, if they haven't made it safe for us, if they're not, our company is not providing us with masks, if they're not providing us with hand sanitizer, if they're not providing us with sanitation cleaners for our check stands, aisles, and so on and so forth, or even soap in our bathroom or paper towels in our bathrooms for our workers or our customers, that's already hurting us and the industry and making us it's more susceptible to catching COVID-19. And fortunately, I work at a store where there's only been 4 cases, but I have one store has 29 cases, one store has 10 cases, and it varies from store to store, but that's unacceptable. And all it comes down to is keeping your employees safe and supplying those supplies like I just said. And also another major issue is because with our customers, social distancing and keeping a correct amount of customers in store and allowing them right amount of customers in store. Our company, well, my company in particular, cares so much about money that they just say, open the doors. Well, this store can hold up to 150 people. Yeah, but are you counting the 150 people? Are those 150 people all wearing masks? Are those 150 people social distancing? And is it even 100? Are you counting the 150 people? Like at first we were, stopping customers and had them lining up, and we're only allowing 10 at a time so much, and that was excellent. Customers were able to shop freely. They were able to see what they wanted to do when they got in line. You had a distance. We have the marks now. Customers away. We didn't have long lines. It was just you go, you come out. When we have customers just rushing in like it's regular, like nothing's going on, and you have people pushing up against each other, and I have lines down the aisle because people aren't social distancing, that's very disconcerting, and it's very it makes us as workers panic. Like
Sure.
I panic when I'm in I see all these customers together. I'm like, this is not safe. This is what causes COVID-19. And me and my coworkers, I had to go and speak to my manager and also one of my other coworkers on a different day. She's like, the person who was in charge in the front end. She said, hey, the store director said we could close the doors and stop allowing people in. She was like, well, he's not here today, so I just told they just said let him in. And my coworker had to actually go to the manager upstairs and talk to that manager to get that manager to come down and close the doors, and that's unacceptable.
That is unacceptable. Gabe talked a lot about the issue of masks, and I'm glad you cited that as well. But this is a really serious problem where you have elected officials, you have some people, including the current resident in the White House, who has been disseminating misinformation and bad information with regard to the use of PPEs and the use of masks. And it also is playing out in the grocery stores. So some people wear masks, but some people don't. So what is going on in terms of this debate about wearing masks at the worksite?
Well, wearing masks at the worksite is definitely a major issue, and as far as workers, we all have been supplied by our union with masks, so we're safe. And with our customers, like I said, when we do have our security there, most of the time they are making customers, if you don't have a mask on, especially during the day, put it on. Sometimes you get those customers who will have it on maybe, but they'll take it off in the store. And I had an issue at my store when I had a customer come in when he had a mask on, and then he was in my line. The customer behind him came up, like he was like right behind him. He did have a mask on. the guy, with the mask said, "Can you step back, please? Social distancing." He's like, "I'm not moving anywhere." And he's like, "Please step back." And the guy's like, once again, the guy's like, "No." So the guy kind of freaked out that had the mask on, and he smashed all the stuff off the counter and just threw it all over the floor, threw it everywhere. And like the guy was standing there just like, "Well, what? Well, what?" And I'm like, "Oh my God, is this really happening?" Like, two customers are fighting over social distancing, but it really is the truth. Like, you need to step back. This is a serious issue. People are dying because of COVID-19. This needs to be taken seriously. And when people do that and they don't take it seriously, that's a huge issue. And we were able to separate them and get one out and then get the other one out. But, that's scary for us as well as workers.
I asked this question of Gabe as well, but DeAndre, what difference does having a union make in terms of a union that represents supermarket workers here in Los Angeles and throughout California?
Well, the difference that makes having a union is, for me, it's like, I know that I don't have to be afraid of what goes on in my store. For non-union stores, it's like, if I open my mouth and I speak up, like, "No, you need to have protective masks. You need to support us and protect us," I can be fired on the spot. The union protects me for that. And I know that, like, I just can't get fired for being a worker who's speaking up for myself, speaking up for my coworkers, speaking up for my community, and, doing what I need to do to protect myself and my family. Whereas if you don't have those protections, like a Walmart or something, like, you can be fired at any point in time and there's nothing that they can do about it. It is what it is. It's like, okay, well, we don't need you, you're fired. And that's what the power of the union does. The union also can fight for you if they do try to, like, retaliate against you or do anything to you. The union can fight for you. I myself personally have had that issue as a union steward, where they tried to tell me I was doing my job wrong, and the union came in and fought for me. And that's the advantage of having a union. And unions are very important, and people need to support their unions. And if you are a part of a union, you need to get out and you need to vote when there's a union vote, because the more of us that vote and show our strength, that's what makes these companies really look up. Like, if we all come out and show our support, like 100% voters of, when you have 20,000 members, 30,000 members, that makes a big difference.
Well, thank you so much, DeAndre, for joining us and in really linking that there is a direct relationship between worker power on the job, in being able to stand up for your rights and being able to speak out against unsafe conditions that impact public safety, but also the role of the union in mobilizing people to get out to vote and to exercise our collective right at the ballot box. So that's a really important link that we're going to be talking about increasingly between now and November. So thanks so much for joining us tonight. Our final speaker this evening is Rob Nodoff with the LA County Federation of Labor, representing over 800,000 unionized workers here in Los Angeles County. And Rob, I just wanted to start by asking you, what are some of the key things that the LA County Federation of Labor is doing to address the COVID-19 crisis?
Right. Well, good evening, Kent, and thanks for having us on board. And before I dive in, I just want to say amazing job by all the speakers before me. Just wanted to thank Aquilina and Gabe and Linda Delp and DeAndre for all of their great work and for their commentary. And also, Kent, to you, just for always hosting this webinar and keeping us on track. You're one of LA's gems. We're very lucky to have you, and you just are such a leader in our collective movement. So I just want to take that opportunity to say thank you again. As for your question, I think it's safe to say that the Fed has just been a little busy since March. Not to sound like a broken record at all, but we know we're in unprecedented times that we're all trying to navigate, and there doesn't seem to be an end in sight anytime soon, with the governor now rolling back reopening plans, unemployment levels making the days of the Great Recession seem like the good old days. And we're literally, as Linda Delp highlighted, breaking records every single day in a bad way when it comes to brand new cases of COVID-19. And then when we talk about unprecedented, just extending beyond our wildest dreams, I think I read the other day too that there are now squirrels in Colorado that are carrying the bubonic plague. So when we talk about unprecedented times, who had that on their list? But a little more seriously, like when we're talking about all of the needs that are facing working families, where do we even begin to start unpacking and how do we move forward? So for us, we're very fortunate at the LA Fed to have a wonderful workers champion and President Ron Herrera, who's leading us and has reminded all of us that in times like this, we need to bring it back to basics. And that is beginning with milk, bread, eggs, and a roof over everybody's collective head. Since the beginning of the pandemic, the Fed has partnered up with Labor Community Services and the LA Regional Food Bank to feed over 215,000 people, which is the equivalent of the Staples Center being filled up 10 times over. We've also pushed for and passed policies in the city of LA, Long Beach, and at LA County that make the workplace a little safer, including emergency sick days so that workers don't have to choose between going to work sick or losing a day of pay, ensuring that workers have access to PPE like masks, gloves, and hand sanitizer, making sure that workers have the ability to wash their hands every 30 minutes and not be penalized for that. We've pushed to make sure that plexiglass is inserted at checkout stations, and we see that everywhere now. We have pushed to make sure that public restrooms are stockpiled with proper sanitizing equipment and products. And we've also pushed to make sure that when workers walk into grocery stores like the ones that DeAndre works at, that customers are required and mandated to wear masks. We've also partnered with Gene Soroka and his team over at the Port of LA to make sure that, as Gabriel was talking about earlier, that we have ensured and locked down an adequate supply chain to make sure that there is PPE coming into LA County and that we're not being left behind. Back in April on this very program, we talked about a historic right of recall and retention policy that LA spearheaded and kickstarted, and we're now seeing it passed everywhere. And that was to protect hospitality and janitorial workers to make sure that if they are laid off because of this pandemic, that when we eventually reopen our economy, that they'll have a job there waiting for them when their places of employment begin to rehire again. And we've also been engaged on the governor's task force to make sure that as the economy reopens, that we are making sure that workers are centered and prioritized first in terms of any plans. And lastly, we have pushed to make sure that, again, in LA, Long Beach, and at the county, we've pushed to make sure that there are eviction moratoriums in place to make sure that people can actually protect themselves when we have orders that require folks to stay home, that they can actually stay at a home and stay safe. So all that said, that doesn't even scratch the surface collectively of what our affiliates have been able to achieve since March. And I think, again, it's safe to say that we've just been a little busy since March.
Well, it's a tremendous testament to your work, Rob, to Ron Herrera, and all of our friends at the LA County Federation of Labor. The vibrancy of the Fed's work is being felt by hundreds of thousands of workers here in Los Angeles and indeed across the country. I wanted to drill down a little more on the policy initiatives that the LA Fed has been working on, because frequently the policy initiatives that are pioneered here are picked up not only throughout California, but across the country. And so what are you doing specifically with regard to advancing policy on the issues that we've been grappling with tonight?
Well, I'm glad you asked that, Kent, because our philosophy is unprecedented times call for unprecedented solutions. So in other words, it's go big or go home. And in that vein, I am thrilled to announce here that as of this very morning, today, July 16th, our next major policy campaign was agendized by the Board of Supervisors to be heard next Tuesday, July 21st. So a huge special shout out to Supervisors Sheila Kuehl and Supervisor Mark Ridley Thomas for agendizing and moving this motion to establish public health councils in the workplace. And given what we heard from everybody that spoke before me, we understand the importance of that. For the past several weeks, the LA Fed has been working closely with a coalition of labor affiliates like UFCW 770, SEIU 721, and others, and worker centers like Cova, Clean Car Wash, Lane, the UCLA Labor Center, to devise a policy that can utilize the power of workers, who, as we said at the very outset of this call, are the experts in their respective industries, to become champions of protecting the public against COVID-19. In our eyes, the workplace is foundational when it comes to public health, and workers are in a unique position to be the very champions when it comes to stemming the coronavirus. And simply put, when workers are engaged, the public is safer. And we've got a chart to kind of highlight what I'm going to go into. If we can just pull that up real quickly here. So as Linda Delp said earlier on, businesses and work sites are places where the general public congregates to purchase their groceries, eat a meal with a friend or a loved one, or kick back and enjoy a few, should we say, double Pepsis on the rocks, right? With some friends, wink, wink. And the data from the county that you're seeing right before you makes it crystal clear, beyond any reasonable doubt, that the work sites are hotspots for large-scale public transmission of the coronavirus. It's literally off the chart, as you can see. And further, the County Department of Public Health, who, by the way, are doing just an incredible job given the resources that they've got and given the circumstances that they find themselves in. They recently did an inspection of businesses, and over half of them failed. They were out of compliance with the public health order. And there were thousands of businesses, or thousands of more businesses who weren't even inspected because of a lack of capacity and resources on the part of DPH. And that's pretty scary when you consider how quickly this virus is spreading. All violations need to be reported ASAP. And we need a framework that can help to expedite this process, because as Linda's graph showed, one person can quickly spread it to a community. And who better to witness and report these violations in the workplace than the very experts, the workers themselves, right? So we can take that slide down and I'll get into like the actual policy frame here.
That's great to share that. And that's amazing timing that this coming Tuesday, this initiative around public health councils will be addressed before the Board of Supervisors. So what is a public health council and what could it do at the workplace?
Yeah, Kent. So it's our policy framework is pretty simple. We've developed a two-tiered approach that will, one, allow workers to form public health councils in the workplace, and second, create a process to certify third-party worker and community-based organizations to assist these worker public health councils with education, intake, and enforcement. And the thinking is workers are in a unique position to be the eyes and ears in the workplace. Workers like DeAndre see firsthand whether or not customers are, or even their fellow coworkers are adhering to public health guidelines. It's the workers who are first to see it, and they're in the position to be the first to report it to the proper authorities so they can address this issue before it transforms into a hotspot. Ken, it seems basic enough to most folks, right? But unfortunately, it's really not as simple as it sounds. In fact, if it was as simple as I laid out, we wouldn't need this policy to begin with, right? Quite frankly. But here's the dirty secret behind all of that. Workers are under immense pressure not to say anything when it comes to customers disobeying public health orders. We've got some disgusting stories and unprecedented, just horrible stuff where workers who tried to tell a customer to put on a mask were spit on, or where customers have waited outside in parking lots for workers for their shift to end, to go out and try to attack and assault them for telling them to put on a mask. And even more so, because of the state of the economy, there are business owners who want to put the whole mantra of the customer is always right ahead of public health criteria and say, I don't want to ruin that customer's experience. I want them to purchase something from me, and I don't want them to go somewhere else. So don't just look the other way if they're walking in without a mask on. And that's not good for anybody or any of us listening to this in our overall public health. Even more so, we all know that workers like DeAndre don't eat, sleep, and live 24/7 at their job. So when their shift is over, they're going where? They're going back to their homes and their communities. And so if workers are flaunting those public health guidelines, as Gabe was outlining, it's the workers who are taking that back home to their communities and to their loved ones. And that's a potential new spot of spread. And when we talk about issues of equity, what is the face of essential workers? We know that they are disproportionately represented by women and workers of color. And so is it any coincidence that when we see these outbreaks, that it's disproportionately hitting communities of color? I mean, no coincidence there, right? We see that 42% of Latino workers and 53% of Black workers are unable to work from home. They have to go to their place of business. So we have to make sure that there are safety guidelines in place. And then the final part of it is the certified third-party work organizations, whose role will be to expand the capacity that DPH needs on hand to make sure people are complying. And they will do three things. They will do initial outreach to workers, informing of the right to form a council. They will educate workers by industry on the most up-to-date health guidelines, and they will assist with worker intake, or with intake in the instances where there are, in fact, violations in the workplace. So it's a big policy. It's a lot to chew on, but it's so needed in this very time.
That's great to hear that the LA County Fed is spearheading these public health councils. It is so needed, not only for the workers in these workplaces, but for the public at large. This is really in everybody's best interest in terms of respecting public health guidelines. And so a shout out to our good friends Sheila Kuehl and Mark Ridley Thomas on the Board of Supervisors for carrying this initiative. So for the last question, Rob, what can people who are viewing this tonight, we've already learned about the importance of supporting SB 275, but what can we do to support the establishment of these public health councils?
So it's right there on your screen. We'll be quick with this, but there are two things you can do. One is you can write a letter or call your supervisor and tell them to support public health councils on Tuesday, July 21st. And the second is we're going to be doing a socially distanced car caravan around the Board of Supervisors beginning at 9 a.m., but we'll be congregating at 8 to make sure folks can get placards on their cars. And we're going to be doing a press conference with some workers, with a restaurant worker, with a grocery worker, and some other folks to make sure that people understand and the public understands the importance of this initiative. So please come and meet up with us on Tuesday at 8 a.m. Over at the Los Angeles State Historic Park, which is located at 1501 North Spring Street, and we will take it from there. So please come and join us. And when we say this is unprecedented, that's also code for meaning this is going to be a very difficult fight. It's not going to be easy. We're going to need all hands on deck, and we need to come out strong on the 21st. So we hope you can join us.
Thank you so much, Rob, for the great work that you're doing and the LA Fed, and for anyone who can join us Tuesday, July 21st, 8 o'clock in the morning. If you haven't participated in one of these caravans with the LA Fed, they're extraordinary. They're moving, they're inspiring, and they're absolutely needed to show broad-based community support for public health councils. So I wanted to thank once again our guest speakers, Linda Delp, Gabe Montoya, DeAndre Williams, Rob Nodoff, and we're going to wrap up this segment of Labor's Voice with my good friend and the executive director of the Filipino Workers Center. We'll close with a song. Welcome back, Aquilina Soriano.
That's right. I'm going to be in the caravan too on Tuesday. So I'm going to close out with Ella's song from Sweet Honey in the Rock. So you may know this. So even though you're on mute, you can sing along if you want to. We who believe in freedom cannot rest. We who believe in freedom cannot rest until it comes. Until the killing of Black men, Black mothers' sons is as important as the killing of white men, white mothers' sons. We who believe in freedom cannot rest. We who believe in freedom cannot rest until it comes. Now that which touches me most is that I had a chance to work with people, passing on to others that which was passed unto me. We who believe in freedom cannot rest. We who believe in freedom cannot rest until it comes. To me, young people come first. They have the courage where we fail. And if I can but shed some light as they carry us through the gale, we who believe in freedom cannot rest. We who believe in freedom cannot rest until it comes. Not needing to clutch for power, not needing the light just to shine on me. I need to be one in a number as we stand against tyranny. And struggling myself don't mean a whole lot. I've come to realize that teaching others to stand up and fight is the only way our struggle survives. Now we who believe in freedom cannot rest. We who believe in freedom cannot rest until it comes. I said, we who believe in freedom cannot rest. We who believe in freedom cannot rest until it comes. So join the caravan on Tuesday.
Thank you so much, Aquilina Soriano. Thank you to all the speakers, and thank you to the media and tech team, Hugo Romero, Evan Santoso, Citlali Chavez, Silvia Vasquez, Justin McBride. It took a whole team to put this together. See you out on Tuesday, see you out on the streets, and let us fight to win public health councils and let us pass Senate Bill 275. Thank you, everybody, and we'll see you again on the next Labor's Voice.